Welcome to the Love Doc Podcast. I'm your co-host, Raina Butcher, here with our host, Dr. Sarah Hensley, the owner, founder, and CEO of the Love Doc Relationship Coaching Services and the Love Doc Podcast.
Hello.
Hey, how are you?
I am doing pretty good given the week that I've had.
Yeah, we both kind of had a crazy week.
We did, and it was just, it was crazy.
Yeah.
But I'm good.
Yes, I am too. And we're super excited for our guest
Very
today.
excited for our
Dr.
guest.
Rebecca Eudy. She is a certified sex therapist. Rebecca, we are so happy to have you.
Yes.
Just tell us a little bit about yourself initially, and then we'll get into like the really good stuff.
Yeah, absolutely. Thank you so much for having me. I'm really excited to be here talking to you guys.
Yeah, absolutely.
So I work mostly with couples. I'm based in the Boston area, and I have a private practice, a clinical practice. This book that I've just written that we're going to be talking about today really grew out of this clinical practice. So couples would come in and I would hear the same thing over and over and over again. And so that's sort of where this work, what we're going to be talking about today, it's really informed by this clinical practice.
Yeah.
I've seen it a million times. I'm sure that you have as well.
I see a lot of this as well.
Mm-hmm.
Yeah. So relevant.
So tell us first off, you have a book that's being released this month in October. This week, actually, is when your book will drop. And just tell us a little bit about it, because it's a very, very interesting topic that I think will be extremely valuable to our listeners.
Just reading the introduction, I'm already can't wait.
I'm intrigued.
I'm very intrigued. Yes.
You guys are too kind.
Yeah.
It's certainly been a labor of love. And so the title of the book is called Parents in Love, A Guide to Great Sex After Kids. And as a parent myself, I have 2 kids. It's not only out of the clinical practice, but it's also out of my own experience. It's really, really hard to maintain any sort of a relationship, let alone a sex life after kids, because things just are so busy. There's so much going on. You're taking care of these little humans that have endless needs. And it's like someone's always literally wedging themselves between you. And that's not even counting all of the scheduling and the calendar challenges. So this, the book is really about, at its heart, about desire differences and how you can work with that. And those desire differences are inevitable in a long-term relationship. Whether you have kids or not, that it's just the couple that never has a difference in desire is a rare couple indeed.
Yeah, I agree.
sure.
And even as I was reading it, I was like, yep, relatable, check. And I'm a newlywed, and I married later in life. Now I have a child, but he's almost 19 years old from a previous relationship. And so even as a newlywed, and, obviously we're in our 40s, we're still struggling, right? So no children, unless you count animals and pets, which can be its own, headache at times. But there's still, some desire issues or imbalance, I would say, at times. And so, I find it interesting that it kind of, and you even mentioned this in the book in the beginning, it's not just for parents per se, it's really just for all couples.
Yes, that's right.
Yeah. And so you have a 3-step process that you really use in your practice. So tell us a little bit more about that.
Yeah, absolutely. So the 3-step practice is really informed by the method that I use a lot with couples, which is emotionally focused therapy, which is an attachment-based method. And so the first step is to notice. So in EFT, we talk about the cycle, which is really this very predictable, really familiar way you get stuck. It sort of feels really hellish when you're stuck here. You're like, I can't believe we're back here. It feels so familiar. It touches on all of our deep attachment wounds, these sort of like big red buttons that our partner probably didn't install, but they're so good at pushing. It's things like unseen, unlovable, not good enough, like those really deep attachment longings or fears. And so noticing where you get stuck, noticing what happens for you that's predictable again and again. And we often like to blame our partners for this. You make me feel this way. And it's true, they do, but it's also our responsibility to notice if there's a pattern in the way that our partner is making us feel. Chances are that pattern probably starts with us. Some sensitivity that we have. And it's not your fault.
Right.
Just to be clear, right? Responsibility is different than fault.
Absolutely.
Right. And so I think, so the next, so notice is first.
Notice is number one.
And then second is own, which essentially is just taking accountability.
Yes.
And then third is the connection. And so elaborate a little bit more on that, because I think it's sometimes hard because resentment, if we're talking about resentment, which I think comes into play a lot in these situations, is when you try to connect after these really hard things that you're dealing with, because sex is a hard thing to talk about. It's hard to come back and connect. So how do you walk your patients through this, or clients?
Yeah. So connect doesn't necessarily mean have sex. It can, certainly that can work for some couples. But connect really it can be as simple as connecting over, wow, we really got stuck there. I felt really bad and so did you.
Yeah.
Yeah, and I usually see that in a dynamic where there's attachment insecurities, especially some of the ones that oppose each other so painfully, like the fearful avoidant and the dismissive avoidant. And they're very, very stuck in a very predictable cycle that just feels like they're on a merry-go-round of frustration. And both partners are really hurting. And when I see partners in the beginning, most of the time they have no idea how much the other person is really hurting. That's just not, they're so stuck in their own pain and they feel so justified in their reactions that they're having to their partner. And a lot of what they view their partner's behavior through is their attachment filter bias, right? So, the fearful avoidance looking at the dismissive avoidant and thinking, well, you just must not love me. You don't care as much as I do in this relationship. And the dismissive avoidance, like, you're always criticizing me. You're always attacking me. When really, the fearful avoidant just feels like I'm trying to share how I feel, but it comes off as an attack. And then we get the conflict cycle, and then both people eventually in the relationship end up shutting down into their avoidance. And then we have two very, very disconnected people if this has been going on for a really long time. So when you see couples that are in a really disconnected place, how do you handle that differently than, say, a couple who is just starting to realize that they're getting stuck and they come in for early intervention? How do you handle those clients that have been in that pattern for a really long time?
Well, it's really similar, actually. When you have someone who's been stuck in the pattern for a really long time, there are resentments that have built over time. So we just have to sort of wade through those. So it might take longer to get to the point where they're able to recognize you're hurting so much. On the top, it might look like you don't care about me. That's how your protective behavior makes me feel. But I understand actually for you that underneath you're in really deep pain.
Right.
And people wouldn't get stuck in the cycle if they didn't really care about each other. That's usually where I start, is by highlighting you're here because you care. It wouldn't hurt so much if you didn't care. And so once we can kind of get people to recognize, wow, my partner, I see this behavior that I don't like, that's really painful for me. And you know what? They never have to like it. They can go through their entire life with this person and be like, I hate when you do that. That's fine. But what we want to try to do is by recognizing the care and the pain underneath each person's behaviors, seeing them in a little bit of a different light.
Right.
Yeah. And I want to talk a little bit about the patterns, because even as I was reading the first, excerpt, the pattern that you talked about with the very first couple was just so relatable, right? Where he slaps her on the ass and she's like, this doesn't turn me on, right? But then he's like, well, I can't help it. I just want to touch you so much. And then, the whole well, I'm touched all day by the kids and and then you gave the example, and I'll let you kind of elaborate on it. But even when you gave the example of what if he did this instead, and then how would that make you feel? And I was just like, whoa, yes. Yes, that's what a woman needs, right? So I'll let you elaborate on that because I found that extremely relatable.
Yeah. Well, so first of all, like we've been talking a little bit about the emotional cycle, but these cycles, they're both emotional and sexual. And so a lot of times what you have is somebody who might be emotionally avoidant, but more of the sexual pursuer. So they may be initiating more in the bedroom. And, it's pretty common that this might split along gender lines in a heterosexual couple. So it's more common that men have a little bit more language around initiating sexually, and they struggle a bit more with initiating emotional conversations. And, I'm not sure what the reason is for that. My hypothesis would be that it's probably conditioning, that boys and men don't get as much emotional coaching as women do, but that's sort of a different conversation.
I do. I think that it's moderated by attachment. So I think, the fact that most dismissive, not all, but a large majority of dismissive avoidant individuals are men, and that society does have a conditioning factor role that is played where, men are supposed to be more stoic and not be as in touch with their feelings. And then the cultural sort of shame aspect around sex with women, I think it plays a role as well, that women are not supposed to be as sexual or is sexually open, and where it's sort of glorified sometimes with men in culture, it makes them feel like it's more appropriate. And what I've found with dismissive avoidance in particular is where they struggle with emotional vulnerability, a lot of times their sexuality is the one place they can feel connected and fulfilled and vulnerable with their partner. And so it sort of minimizes the impact of them not being able to be emotionally vulnerable with their partner. But then if their partner really needs emotional vulnerability, and usually they do, then it becomes an issue that there's no emotional safety in this relationship. Therefore, I, as the woman, cannot feel vulnerable sexually with you. I don't feel like I can open myself up sexually to you because I am so closed off because of the lack of emotional vulnerability and safety.
Yeah. And I'd say that's a pattern you probably see
constantly
a lot as well.
I'd love for you to just elaborate on that.
Yeah.
Yeah, absolutely. So what you're talking about that you really nail, I mean, that was such a beautiful summary of how it can happen is, so I would call that a crisscross cycle. So you have an emotional cycle where one person is the emotional pursuer. So they're going and they're saying, hey, you did this thing, I didn't like that, or you make me feel this way. That can feel like, to the emotional withdrawer, like they're blaming, like they're criticizing. But really, they're reaching for connection. That blame, that criticism, it's reaching for connection.
Absolutely.
Now, it has a twist. It doesn't always feel good. It doesn't always come out the way that we intend it, but it's reaching for connection.
Yes.
And the same thing. So then when you have a couple where the person who's the emotional pursuer outside the bedroom is the sexual withdrawer, oftentimes what they end up saying is, if you were more emotionally available, I would feel like having sex more. And the sexual pursuer says, well, if we had sex more, I would feel more emotionally available. And so you get to sort of a stalemate.
Yes.
So that's one option. And to be honest, like as difficult as that is, when I see couples coming in, both of them have a lot of resentment around that because they're not feeling like they're getting their needs met.
Right.
But it's balanced. They're each pursuing and they're each withdrawing. And so that's easy to sort of draw parallels there. One of the cycles that can also happen is when you have sort of an alignment. So somebody is both a sexual pursuer and an emotional pursuer, and their partner is very deeply withdrawn, both sexually and emotionally. And that can be really challenging to work with because it's a bit less balanced, like their roles are very entrenched. And so that can be challenging.
Yeah, absolutely. I see that in the fearful avoidant, dismissive avoidant dynamic when the fearful avoidant has shut down out of hopelessness, and then it activates the DA's sense of loss a little bit, which de-triggers them some. So they feel a little bit more like in the beginning of a relationship when they can be really vulnerable because it's a little bit more low stakes. Their partner kind of giving them that space, it just triggers that feeling of loss, which makes them kick up their emotional pursuit a little bit more. Not like somebody with anxious attachment would, but a little bit. And then they are seeing their fearful avoidant partner, who was once very much a pursuer in both areas, just completely cold because of the hopelessness, and they're behind that wall of pain that the fearful avoidant can have.
And I know the dismissive avoidant too sometimes feels like when they're pressured, and this is one thing I wanted to ask about too, like the correlation between pressure and desire. And we were actually talking about this on the way here, and how when a partner feels pressured, it diminishes the desire. And I think sometimes, specifically with the dismissive avoidant, it just feels like another task
that they have to,
right? Another expectation that they have.
So when I see the DA being the one that's the withdrawer sexually, they usually almost always tell me it just feels like another expectation. It just feels like another pressure, and I already feel like I have, more with my work that I can cope with, or outside stressors or whatever. And so it can be interesting how the dynamic shows up in the different attachments, but it's not always super consistent.
Yeah.
Right.
Yeah.
So it depends on the other dynamics in the relationship and how long these negative cycles have been going on and where everybody ends up. So talk to us a little bit about pressure, because I do hear that a lot as well. I get pressured all the time, and that just makes me want to do it less. And
Well, that's the first thing that I do when I work with a couple, is we have to take the pressure off, because you're absolutely right. Pressure kills desire, obligation, and pressure. And so what you have when you have a couple that's in this pattern of having sex because there's entitlement and obligation and pressure is that you have obligation sex. And so this looks like, oh, well, if I don't have sex with my partner, they're going to be upset. They're going to be grumpy. They're going to be, sad. I don't want that for them. I don't want that for me. So I'm going to go ahead and have sex with them. And then it sort of checks off the list. And I often hear people talking about like, okay, now that's over. Maybe I've got a little breathing room for like a week or 2 weeks until they start to get kind of antsy again. And then you're back in the same cycle. But this is not satisfying for anybody. Even the higher desire partner, they are not getting the kind of connection that they want. Because the thing is when we talk about sex, like, of course, people want sex because it feels good. Well, if sex feels good, they want sex, right? If you're having bad sex, you're not going to want bad sex. But if it's just about how it feels or just about the orgasm, you would just masturbate.
Right.
And so it's about more than just that. It's about connection. It's about feeling desired. Yes. It's about being close to another person. And so when the sex is just done out of obligation and there's this vibe of like, just get it over with, then that's really not satisfying even for the high desire partner who's initiating sex. And it really kills the desire of the person who maybe is lower desire.
Yeah. And then there's guilt on the higher desire end as well. They're like, okay, well, I feel like I'm just getting I don't know if you know anything about my story, but my ex-husband and I had a really bad abusive relationship. There was a lot of infidelity. I ended up shutting down sexually to an extreme extent. And then, I was always afraid he would keep cheating on me, so I would do it out of obligation. And then he, I in my dysfunction was like, well, you should be thankful for that, right? Like, you should be thankful that I did this, because I really don't want to. But I didn't realize at the time how kind of demoralizing that felt for him, how he felt hopeless and felt like somewhat guilty, I think. Or maybe he didn't, I don't know, but it came across as maybe he did. And he used to call it charity ass. You're giving me charity ass.
Nobody wants to be a charity case.
It doesn't. It doesn't.
No. There's no pleasure in it. There's just no.
For so long, I just said, well, how could I ever feel safe to have sex with you when you've cheated on me so much and you've hurt me so much and you've lied to me so much and you treat me like crap? But at the end of the day, I was choosing to stay in that marriage way longer than I should have. And so I had some responsibility. My view of it at that time was, well, you've treated me so bad, so you don't deserve anything.
Yeah.
And it's like, at the end of the day, maybe he deserved for me to just leave him instead of putting him in that position.
Probably.
Sounds like he earned it.
Yeah, he did. So I'm curious, when you're with, your clients who have maybe there's been some infidelity. How do you guys navigate that? Because that's a whole nother bear.
It is a whole nother bear.
Yeah.
That's a great question. Yeah. Talk to us about that.
Yeah, I mean, talk about attachment injury, right? Like that's the ultimate, and it's traumatic. It creates an actual trauma, and people who are the betrayed partner, they have a trauma response that looks a lot like PTSD.
Absolutely.
And so it's trauma work. A lot of times what I see actually when a couple comes to work with me immediately after an affair is actually it's not uncommon for them to be having a ton of sex because the betrayed partner, if they've decided to stay, they really don't want their partner to cheat again.
Right.
And so they're like, I got to keep them here. There's often like a lot of emotional intensity, a lot of physical passion. It's just, but it's not sustainable.
Right.
And it's hiding an insecurity where it has to be safe enough. A lot of times, once we start processing the affair and once we start creating more emotional safety, that sex often does dry up because there's trauma, because it's not safe, because we have to work through the infidelity first.
It's a fawn response.
It's a fawn response. That's exactly right.
Yeah. Yeah.
And it's a fawn response. And it's sad because we know that fawn is like a form of functional freeze where both your sympathetic system is activated and your dorsal vagal shutdown is activated. So it doesn't feel safe to run. It doesn't feel safe to fight. It doesn't feel safe to do anything but just collapse into pure vulnerability. And that makes you feel captive, like you've been kidnapped.
Yeah.
Yep. Absolutely. But one of the things that actually a lot of times when I work with couples, they feel better, right? I mean, it feels terrible because there's so much intensity and they're in chaos and it's crisis and everything. But a lot of times people will describe being so disconnected before the affair.
Yep.
And so they are deeply like collapsing into vulnerability. And so sometimes when people come in and they're committed to working on the relationship, but there's been an affair, they actually are feeling so much more connected than they have in a really long time. But that can really hide a lot. Like you're saying, it is that fawn response that you have to get through.
And I think what I can help people identify is that they're confusing the emotions in their body of fear with excitement. So it's really a fear response, right? So your heart's pounding and you're feeling butterflies and you feel the surge of adrenaline, but really it's your body in fear. It's not that sexual excitement that you think it is for the betrayed partner. And a lot of times they come into identifying that they were operating from a base of fear after the initial betrayal because they were traumatized.
Yeah.
100%.
We want to take a moment to thank our sponsor of this podcast, Cozy Earth. Thank you so much, Cozy Earth. We are so thrilled now that we are moving into the fall in Kentucky. And actually this week, it just kind of like turned fall overnight to use our fuzzy Cozy Earth bubble blankets.
Love it. Yes, it is slightly weighted. It is so soft and luxurious. And it was a really beautiful gift that Cozy Earth gave us to try out. And I have been using it at night when I get a little bit chilly while I'm watching TV. And it's just been fantastic. I am such a fan of the pajamas and the sheets. Let's just talk about viscose from bamboo. It is some magic that they create.
It's fancy.
It's very fancy. I don't know how they do it, but it is the softest sheets I have ever slept on in my life.
They have an entire clothing line too.
Yes.
So I was on there the other night because they constantly run great sales in addition to the promo code that we offer for 20% off with code LOVEDOC. But I mean, they have like cute little tees and crops.
I just bought the little robe, the thin robe. And listen, guys, that's what I've been wearing in the car line every day. Is that I just throw it on because I was wearing my big heavy robe and I was getting hot and it's been wonderful. Every product I've ever received from them has been wonderful. So please go check them out at cozyearth.com. You can use code LOVEDOC and you will receive 20% off of your purchase. So thank you, Cozy Earth.
Thank you, Cozy Earth. And I want to talk too, this kind of leads into this, sexual shame and when you bring sexual shame into a partnership and how this plays a role. I can talk candidly. I have some sexual shame that I haven't fully processed through in my life. And so this becomes an issue in my own marriage where it's not that I don't desire sex, but I have this feeling, again, we talked about this in the beginning, like females may be a little bit more conditioned to think that sex is bad, right? Mm-hmm. And then you add layers onto that. Like I was a preacher's daughter and, so then there's some religious shame around sex. Mm-hmm. And then, you have your own personal experiences with sex as you get into adulthood. And now that I'm in a healthy marriage, this is kind of what's ironic about it. Then it rears its ugly head, right? Mm-hmm. And so I'm curious just to get your take on the role of sexual shame and really how to get through it and process it so that it doesn't affect your sexual relationship with your partner.
Yeah. Well, first of all, I just want to normalize because everybody has sexual shame.
Yeah, for sure.
Mm-hmm. Yeah,
for sure.
I mean, there is not a person. Sex is an area of great taboo. Most people grow up in a house where it was not talked about, mm-hmm. or certainly not in a healthy way.
Right.
And when something's not talked about, then it creates shame. And on top of that, the messages that we see in movies, in porn,
yes.
in the mainstream media are really, really deeply confusing, especially for women. Be sexy, but not too sexy.
Mm-hmm. Right.
You don't want to be a slut. You don't want to be a cock tease. You don't want to be, there's so many, it's like threading this needle. And so I don't know a single person who's gotten out of their childhood and out of life without sexual shame.
Yes.
So that is a
thank you for saying that. Yes, thank you.
Thank you for validating that for us, because I grew up in a Catholic family. You didn't talk about it. It was just nobody said anything about it.
No,
you'll figure it out on your own, I guess. Right?
And like when my parents found out I was sexually active, it was like the end of the world. Right? It was like, I'll never forget the blow up that was my mother when she found out that I, with my high school sweetheart, had found out that I was having sex. It was just like this big, terrible thing. And so, I think that now that I'm older and again, thank you so much for normalizing it. Cause even saying it sometimes, like just saying the words, like I have sexual shame, I can feel myself get a little dysregulated in my body. Mm-hmm, mm-hmm. But you just normalizing it just then just kind of made me go, okay. Yeah, you're right.
Because I think a lot of us just felt like we were the only ones.
Yeah. Everybody feels like, their catastrophe is the only catastrophe, right? I think we kind of make that mistake as human beings, but we're a lot more relatable than we think, and we have a lot more of the same experiences than we think. But, again, back to just really processing the shame and, getting through the shame. How do you guide your clients through that?
Well, I start by, so first of all, shame loves darkness. Shame thinks it's alone. We got to expose it to the light. So normalizing is the first step there. Like, hey, everybody raise your hand if you got sexual shame. Like every hand, if you're being honest, every hand in the house is going to go up.
All right.
I think that particularly with women, one of the places that I start is actually talking about self-pleasure. Because women, self-pleasure and masturbation is normalized for boys and for men, but not for women. And so a lot of sexual shame for women lies around how they look and how they perform. It lies around whether they can please their partner and whether they themselves are able to orgasm and make their partner feel good about the pleasure that they've given them. So women do not fake orgasms for themselves. That doesn't make us feel better. We do it for our partners. That's, so unless you as a woman have been able to explore your own body for your own pleasure and for your own desire, then the sexual shame there is really so that's a place that I start. And a lot of times talking about self-pleasure and talking about masturbation brings up so much shame for people. And it's easier to work with that on a solo level than it is on a couple level.
Right.
So you can do it, both ways, but if someone's not willing to explore self-pleasure, then it's really going to be hard to have them unlock their desire, to be able to talk about what feels good in their body, what brings them pleasure, and not feel like there's something wrong with them or they're broken or they don't know how to do it.
AKA bad, right? Like there's this whole stigma of like being bad. Like if you do this, you're bad. Or if you're too sexual, you're bad. And so I know that's where I struggle, right? Because where internally I already feel AKA bad. And then when I go to be a sexual being, then I'm like, oh, it's like that.
It's cognitive dissonance.
Yeah, the subconscious kind of says, "Oh, but you are bad," and then it sends me into that default. Yeah, where I just
yeah, absolutely. Yeah. So a follow-up question to that is, if someone is really struggling because of shame or embarrassment or fear of rejection with telling their partner, here's what feels good to me, how do you guide a client through that? Because I hear that a lot. I actually, when I work with couples, I often work with them separately first, and then we come together for couples work to give them some foundational tools and skills so that the couple session doesn't just derail right off the bat, and kind of prepare them for the couples work. And I hear a lot, I really want to tell my partner what feels good to me, but I'm scared they'll reject me, or I'm scared they'll be like, oh, I wasn't giving you pleasure all along. You're just now telling me this. How can we have been together so long and you're just now telling me that this is what has felt good? So then the longer it goes on with them not having told their partner what they really want, then there's like almost a trust break there. Like, you couldn't trust me in the beginning with this information. How do you break it to them that, hey, actually all along, it would have really felt good if we did this thing? How do you deal with clients in guiding them to be open and vulnerable and honest with their partners about what feels good? And then if they haven't been honest in the relationship, how can you help them reveal that without
anybody's feelings getting hurt?
Yeah, anybody's feelings getting hurt in the process.
Or maybe they just get hurt and they have to deal with it.
Such a good question. So I start where people are. So if I have a couple who's coming in to see me and they're talking pretty openly about sex already, but there's certain things that they'd like more of or like to communicate, then that's a place where you can work with that. I always recommend that people start with the positive. So if your partner has done something that's in the ballpark of what you like and you want them to do more, wow, that felt so good when you did that. What did you do there? That was amazing. So really like giving some positive reinforcement can increase behavior. So that's a couple who's comfortable talking about sex, reasonably so. And then there's like some tweaks that could make it more pleasurable. But if you're not comfortable talking about sex at all, I wouldn't recommend that someone go in and just say, I want you to do this, because the risk there is so huge. We want to stay within the zone of tolerance, because what can happen is if you ask for that and whatever it is that you want and your partner's like, ooh, I don't know, they have like not the perfect reaction, then that shame comes in and it can just get so shut down. So I look at what they're asking for outside the bedroom. And there's some exercises that I have couples do that are touching exercises. So in sex therapy, most of, the assignments that you would do that are touching assignments are done outside the therapy room. I would give homework, but sometimes we practice in the therapy room with something like a hand massage or face, and so the exercise, it's called sensate focus. And basically what it is it's a touching exercise that's all about communication. So touching is just the vehicle for the communication. So if your partner, say, is giving you a massage and you're like, this feels terrible. Can I swear on here?
Yes.
Yeah.
Yes.
We'll mark it explicit.
Yeah. This is already explicit anyway.
Yeah,
so
it's already explicit. This feels fucking terrible.
Yeah.
I hate the way they're touching me. Oh my God.
Oh my gosh.
Skin hurts. I'm cold, whatever. And they don't say anything. They're just silent the whole time. Thanks so much for the massage, honey. So what's going on there?
Yeah.
Do you ask for what you need in a non-sexual context? Are you comfortable telling your partner what feels good or not good in your body or even in your feelings? And so if the answer is no, then we would start with something that held a lot less shame than sex. Because if you're struggling to communicate what you want and what you desire because you're a people pleaser or because you feel shut down or because you're afraid that your partner's not going to be receptive to it, maybe they haven't been in the past, and then we layer sexual shame on top, that is not setting anybody up for success.
Yeah.
So I would start slow with people to set them up for success.
Okay.
Makes sense. Makes perfect sense.
Communicating just about normal touch or non-sexual touch. That's really great.
I love that practice, actually. I might try that practice. I do want to switch gears just a little bit because I want to go back to your book, right? And the overall meaning of what it's really about. And I think that one thing to bring up that I found really interesting in the initial excerpt is the do no harm agreement, which I thought was really beautiful. And gosh, if every new parents had this clause that they just sort of followed, I feel like it could create so much more harmony in the beginning of becoming new parents or parents to, the second or third or even fourth child. So just elaborate a little bit on that for our listeners.
Yeah, so I always suggest that new parents put this do no harm clause into effect, which essentially says none of us is going to be at our best. Yeah. We're surviving during this period of time. We're not thriving. Nobody's living their best life. Nobody's, optimizing and maximizing and doing all of the things that we think that we should be doing all the time. We're surviving because the family is adjusting to introducing a new human into the family. And so for a lot of couples, this can happen actually even starting with trying to get pregnant. So if someone's struggling with fertility, it's really, really stressful, and their sex life can take a huge hit. Their emotional connection can really take a huge hit. But certainly during pregnancy, when there's lots of hormones on board, and then during immediately after a baby is born, really up until birthing parent is done breastfeeding, if they're breastfeeding, and everybody's sleeping through the night again, which can be a couple of years.
Yeah.
So I would say a minimum of a year, conception through a year. But for a lot of people, realistically, that's probably more like 2 or maybe even 3 years.
Especially if you introduce a second child or a third child.
That's right.
Yeah.
So your do no harm, it resets and resets and resets.
Yes.
Yeah.
But it's such a great clause. And I mean, it's simple, right? It's a simple concept. But I think that if more parents, and I know not all children are planned, of course, right? So you can't get this concept into your mind, sometimes before you have a child. But even during, pregnancy, if couples had this clause and this concept in their mind, I just feel like, wow. Like I think about all the pain that maybe could have not happened in my first relationship, even though, my son wasn't planned. Like if we'd had this idea around, hey, we're not going to be our best selves for a while. Let's conceptualize that and show each other some grace and realize that there may not be a lot of sex, or there may not be a lot of date nights. There might not be a lot of trips away, right? And we might not have this alone time either, because alone time as a parent and even finding sexual desire, I think, is very important. And even outside of something like masturbation, just like going to the gym, right? Taking care of yourself physically is something that I think really comes into play with sexual desire, which you talk a little bit about. And I don't know if you go into that further in the book, but and you can elaborate a little bit on that if you want to.
Yeah, elaborate a little bit more on the do no harm clause, just for our listeners who didn't get a chance to read it yet, we've read, when we've read it. So go into a little bit more detail about that clause.
Yeah. So The where this is sort of born from is that when you're not sleeping, when you're really pouring everything that you have into this new human that's so demanding, I want grace in that time. I need to remind, as a new mom myself, I needed to constantly be reminding myself, okay, I don't have to be perfect. It can just be good enough. It doesn't have to be, my best self all the time. And so if I want that for myself and I'm struggling to give that to myself, surely my partner needs that too. And so sometimes being able to kind of let and sometimes it gets really sticky. It's like everybody's sleep deprived and you have this fight and it's like, that escalated quickly. Yeah. Okay.
Yeah.
That makes sense. None of us are at our best. We're not at our best. So yeah, and I think what you said about the self-care being
Yeah.
really important for desire, it's so true.
Yeah.
So true.
Yeah.
I mean, ultimately our primary sexual partner is ourselves. When we're being sexual with somebody, we are inviting somebody to join us, and they're inviting us to join them in this connection that we're sharing together. And if you're not feeling good in your own body, if you're feeling your nervous system is totally out of whack, you're either in dorsal vagal shutdown or you're in sympathetic activation, then it's really difficult to invite somebody into your experience. And in order to get to that place, you really do need to have self-care time, whatever that
Absolutely.
means to you.
Yeah. And I think, we all know that working out creates those good endorphins. And, even in females, you get a rush of adrenaline and testosterone, all things that really come into play in the physical part of sex, which we didn't really touch on, but I'm interested in because I know that, as middle-aged women, and I don't know how old you are, but as
Middle-aged, as much as I hate to say it.
But as it's a
it.
beautiful time. It's such a beautiful time, but it's a complex time, right? It's, for me specifically, it's a time in my life where I'm an empty nest and navigating that and navigating, looking back on my parenting life and kind of mourning it, and so there's all these emotions and there's all these feelings, and then your hormones start to shift, right? And your hormones start to change. And so just to wrap this all up, I do want to talk about that because, of course, I know you're not a medical doctor, but I'm sure that this comes into play in your practice where there are middle-aged women who come in and because of some physical component, the desire's not there too, which can't be ignored, right? That I don't want to pinpoint this on men because I think sometimes it can happen with men too, obviously. But it's like, you gotta understand, guys. Like, this is tough, right? It's so tough. So just elaborate a little bit on that too.
Yeah, I mean, hormone shifts are huge. Like even so, certainly perimenopause. The hormone shifts that happen around then are profound and really deeply affect many areas of life, including desire. And then in menopause, also, the hormones can really shift in a way that makes desire and other physical symptoms really can impact sexuality. But this is something that women may or may not be really tuned into even before perimenopause. I mean, I think that when perimenopause hits, it's kind of like a slap across the face and you sort of can't ignore it. But even within the monthly cycle, if for a lot of women, if they're paying attention, there's times that they feel much more desire than others, and it's hormonal.
Yeah.
Yes.
Yeah.
Same with breastfeeding. A lot of times I hear from women, why do I have such low desire? Like, I just don't want to have sex at all. And then they stop breastfeeding and they're like, oh,
Yeah.
wow, that was really
for
affecting
sure.
me.
Yeah. Yeah.
sure.
And so, I think the postpartum hormones are sort of more similar, not hormonally, but more similar in terms of like a slap across the face to perimenopause. It's like sort of difficult to ignore because they can be so intense. But I think that those undeniably they affect women a lot and desire a lot, but often women do a pretty good job of validating what they're going through, at least maybe after the fact of like, wow, my hormones were really affecting me postpartum, perimenopause, especially because there's a lot of societal support for that.
Yeah. Yeah.
But I think in the just the menstrual cycle and the normal cycles that women go through, I'm not sure that women do as good a job, or they're supported in doing as good a job of really validating. There's going to be some weeks that I'm really open and really having more desire. And there's other weeks that I am really not into it at all. And I think sometimes that data is just lost, but it's really important.
Oh, so
It
important.
is.
And I can attest to it.
The female nervous system is, operates cyclically in sync with our cycle. So our nervous system is very much affected by our cycle. And female nervous systems are inherently very different than male nervous systems. And so, yes, we know ovulation might increase your desire. And then I literally become a crazy person the day before I start my period.
Right.
I become almost mentally ill. Yeah. And it's kind of scary. And my husband he's like, you're going to start your period tomorrow every month, because I cry. And like stuff I normally wouldn't cry about. And then I'm just very irritable, and I'm just... There's no way I want you to touch me.
Yeah, do not touch me. Yeah.
But the feelings are real.
They're very real.
And it's so important. There's a reason, there's a biological reason that it's so helpful to validate. Like, I'm not a crazy person. My hormones are really out of whack. But it feels like
I feel like a crazy person, because I feel totally different than the whole rest of the month. Just that day, sometimes 2 days before I'm about to start my period, sometimes even the very first day of my period, I will absolutely cry. And I'm a little bit snippier with my husband, and he's very graceful about it. And I have to catch it and apologize and say, and he's like, I just know you're going to start your period tomorrow.
Yeah.
And I first was very offended by that at the beginning of our relationship, but he was not wrong.
No,
ever.
Right. And he's just taking inventory, right?
He's like, I know you so well that I know it's about the day. It's the mood is here. It's okay, babe. It's okay.
Pretty predictable.
And actually, that has been really wonderful.
Well, it is. It's validating, right? To have somebody be like, look, you're just about to start your period. You're not crazy.
Yeah, I know. You are not this way 29 other days out of the month.
Well, I think that, just this whole conversation just goes to show that your book, of course, is going to be super exciting. I'm going to read it.
Absolutely.
But you're so much more than just, a sex therapist for new parents or parents with young children, because we've talked about such a wide spectrum of topics in this episode. And so I think it just goes to show your credibility, your knowledge, and we are just honestly really thankful. I've been wanting to have a sexologist on for months now, and I was just so thrilled when I met you and I came across you, because I'd vetted a few, but you were the one that I was like, nope, she's it.
Yes.
She's the one. We're going to have Dr. Rebecca on.
I have one more question.
Yeah,
now.
go ahead.
One more question before we wrap up. So my husband and I together have 4 children, and my ex-husband has passed, and so he adopted my 2 girls. And so we're just this beautiful blended family with 4 kiddos and 6 different sports, 2 crazy dogs, and our life is bananas. And our challenge now isn't little kids anymore. I mean, we have next month 2 that'll be turning 8 and 9, nearly 2 days apart. It's hiding it from the teenagers. Because you got to turn the TV up really loud. You got to start the washing machine. You got to do all the things, because I'm not about, my oldest daughter's bedroom's like connected to our bedroom.
And they know what it is now.
And they know what it is. And
you can't really hide
the
it.
little kids, they're like, oh, the
Mommy
TV's
and Daddy are
up,
loving on
whatever,
each other.
But now it's like, it's not about little kids interrupting you. It's about the teenagers being freaked out if they were to think that that's what you're doing. So how do you help people with older children like navigate that?
It's a great question.
It is a good question. Yeah, so I think 2 things. One, you're doing all the things, right? Like put a lock on your bedroom door, turn up the TV, make it so that they're not going to hear you. Nobody's going to walk in. That's helpful. But if they know that you're having sex, they know you're having sex.
Yeah.
They're going to have sex at some point too, like it's like, I mean, I get what you're saying. It feels uncomfortable. And
It does.
Of course, you would never want them to overhear you or walk in on you. But the idea that their parents have sex, that normalizes that people are sexual beings.
Yeah.
And if they do hear you and they're freaked out by it, I promise you, they are going to go to the end of the house and they are not going to hang around the bedroom door
Yeah.
if, your door is closed and the TV's up.
Right.
And so some of it is like, I think normalizing that you can do everything that you can to make yourself feel better so that you're able to relax into the moment whenever you can snatch it. And if they happen to hear you, they're probably not going to say anything. Oh, well, yeah. I mean, like,
Yeah, maybe I just need to get over it a little bit because luckily our laundry room is also on the other side of our bedroom and our washer's getting old.
just
and
start
so
that washer and dryer.
She's loud, that washer. So I'm just like starting a load of laundry, we're turning the TV up, we're locking the door, and it feels a little bit better that way. But it's almost like you had to hide from your parents before, and now you're hiding from your children.
I just love the whole idea. I just love the whole idea of just normalizing sex and just stop treating it like it's like this super taboo thing, right? Because this is something I tried to do with my son as I knew that he had a serious girlfriend and he was sexually active, is that I didn't want to make him feel bad for having sex. Instead, I just said, sex is normal. People have sex. Just be smart, right? Use your head, use discernment, don't get pregnant, these things. Not some crazy, like my experience, like I said, was a little traumatic and I didn't want to do that to him. I just wanted to be like, no, okay, sex is completely normal. And instead, because I remember there were so many rules around, obviously you have to have boundaries with your children. I'm not saying that, but there were so many rules around my life at that age, even though I had a serious boyfriend. And it felt, again, just so like I had to hide. And all it made me do in return is make me want to do the bad things more, right? Like instead of just having the acceptance of my parents. And so I think you're right. I think just normalizing sex in general just makes it just all around better.
Yeah, I try to take like a hybrid approach with my daughter who's 14, which is
daughters are different.
Here are all the reasons why I believe God designed sex to occur in marriage, because it's the safest zone to have sex, right? Because there's a lot of really hard things and consequences that come from sex. And so I believe God did design it to happen in this marriage situation. But I can't guarantee that you will uphold those values as much as I want you to. I know you're going to be your own person and I can only have so much influence. And if that isn't the choice that you make, I also want you to know that you can come to me without judgment and that we can talk about it. And here's what I want you to know about sex, and here's the risks, and here's the psychological risks and the health risks, and but also it can be a really wonderful, beautiful thing. And of course, my desire for you is to use God's design there because of the protection of what God brings to that in terms of the marriage covenant, and if pregnancy were to occur or whatever, you feel a lot safer in that zone. But I can't guarantee that for you. Therefore, I'm also not going to put this shame around it like my, family did, right? Especially any religious shame.
And just not talking about it, right?
And
you said that a lot more.
And not talking about it.
You said that a lot better than I did.
I want to be able to talk about it.
Yeah.
Because I can't guarantee that she's going to do what I think would be best for her. I can't guarantee that.
Every parent wants their child to wait until they're married. Of course.
Of course we want that.
Because there is a protection there. But again, it's like, realistically speaking, I just, you said that, like I said, you said that a lot more beautifully than I did, because I like the idea of a hybrid approach too. Like, yes, you state the risk, you state the possible consequences from it, and the decision if you decide to do it, but at the same time, not not bringing so much emotional dysregulation to it.
Right. I want my daughter to be able to, if she's going to do that, I want her to be able to come to me with any questions or concerns.
Absolutely.
And of course, right, I'm not going to be like, you're so awful.
How dare you do this? Yeah. So
because I don't think that's the way I would ever get through to her about making safe choices.
Yeah, you don't get through to them that way. Absolutely not. And so I know that your book covers a lot. And I mean, you actually, the book itself, I think I read this, it kind of spans the lifetime of the child, correct?
That's awesome.
Yeah.
Yeah, that's right.
Yeah.
That's right.
That's awesome. And so your book is called Parents in Love, A Guide to Great Sex After Kids. And it is going to be released on October 21st. Awesome.
Yep.
Okay. And so tell our listeners where else they can find you.
Yes.
Yeah, absolutely. So you can get the book anywhere books are sold, Amazon, Barnes & Noble, anywhere. And then you can find me on my website. It's RebeccaEudy.com. And then I'm also on Instagram. I'm sure you guys will put that into the
we will.
show notes.
Absolutely. Yeah.
Absolutely.
Yeah.
We'll put all of your information in the show notes. And then when your book comes out, we'll just go ahead and put a link to it in there too. We'll update it.
Because we should be good. If you send me a link release,
I'll do that.
Then we'll put that in the description. And I'm excited.
I am excited too.
Genuinely excited.
Thank you so much.
And I'm not a reader, okay, Rebecca? I'm not a reader, but I really am excited to read your book. And so we just appreciate you so much for being here.
Thank you so much for coming
giving
on.
us your time and for giving our listeners so much valuable information, because I know just from the bottom of my heart that this is going to be super, super valuable for so many people.
Yep.
And so they can seek you out even further through your book or your Instagram. And of course, please go check out Dr. Hensley while you're surfing the World Wide Web at thelovedoc.com. For all of our listeners, we offer a special promo code of 27% off all of her services with promo LoveDoc27. So please go check out Dr. Hensley, go check out Dr. Rebecca Eudy. And until next time, peace, love, and perspective.